Hi, everybody. We're here from the Rocky Mountain MIREC. I'm Adam Hoffberg, and thank you for joining us for the Short Takes on Suicide Prevention podcast. Today, we will be chatting with Melanie Hom. Melanie is a doctoral student over with the Department of Psychology at Florida State University. She is a member in Dr. Joyner's lab, which is called the Laboratory for the Study and Prevention of Suicide-Related Conditions and Behaviors. We're really excited to have Melanie. Today, we're going to be chatting about the impact of suicide on those who have lost a loved one. Zooming in on a pub that Melanie and her colleagues recently published in the Journal of Affective Disorders. The title of the article is Exploring the Association Between Exposure to Suicide and Suicide Risk Among Military Service Members and Veterans. So again, thanks for joining us, Melanie.
Thanks so much for having me.
Great. So just introducing yourself and telling us a little bit about the work that you do and Joyner's Lab in general, that would be a great place to start.
Okay. So as you mentioned, I'm currently a doctoral student in clinical psychology, and I work within a lab that really focuses on enhancing our understanding of suicide. The idea that the more we know about suicide, better we're able to prevent it. And I work under the mentorship of Dr. Thomas Joyner, who's also co-director of the Military Suicide Research Consortium. So as a graduate student within Dr. Joyner's lab, I have the unique opportunity both to support the consortium's research efforts and also to use the wealth of data collected across its many funded studies to examine issues related to suicide prevention among military personnel as well as veterans. And in particular, my program of research really focuses on enhancing connection to high-quality mental health care services among folks at elevated risk for suicide. So we have programs and interventions that can help folks at elevated risk, but we continue to see the lack of use of these services. So I'm really interested in figuring out how to bridge that connection to care.
So just before we start getting into this particular article, I wanted to talk about how we talk about this issue. And suicide, a lot of times the language we use really does matter. When we're talking about those who have been impacted by suicide, it's important to talk about it with the proper terminology and respect. Could you just give us a little background on how we talk about this issue?
Sure. As you mentioned, there are a lot of different terms out there, and so sometimes it's helpful to just make sure we're on the same page as researchers and clinicians. Fairly recently, Julie Sorrell and colleagues published a manuscript sort of outlining their proposed nomenclature. And that's something that we've tried to stick to because it helps to clarify some of these different categories in the continuum of suicide survivorship. So there's three specific terms that are typically used. So there's folks who've been exposed to suicide. So that's knowing someone in any context who has died by suicide. That's sort of that first category. The second category is folks who have been affected by suicide. So that's experiencing more significant sort of distress following the suicide death of someone else and someone else with whom you may or may not have had a close personal relationship, but nevertheless were affected more profoundly by that death. Finally, that third category is folks who have been bereaved by suicide. And so that's sort of even more intense, clinically significant distress following the death of an individual to suicide with whom one had a pretty close personal relationship. So we sort of view those different categories as being nested. So those bereaved by suicide have also been affected by suicide and exposed to suicide, rather than those categories being mutually exclusive. But it is helpful to think about some of those different levels of experience with losing someone to suicide.
Yeah, thank you. That's very helpful. And of course, I'll try to use this language, but of course, feel free to jump in and correct me if I'm not talking about it the right way. So now that we know about the language that we're going to use today, could you talk a little bit about background on the topic, what we already know regarding suicide loss and how it impacts families and friends?
Sure. So we have a growing body of research suggesting that losing a loved one to suicide, knowing someone who's died by suicide, has a profound impact on individuals. Understandably, for family members and friends who are bereaved by suicide, they may experience a pretty broad range of mixed negative emotions. So oftentimes there's feelings of sadness and immense grief at the loss of a loved one. But in addition to that, there's occasionally also feelings of guilt. So sort of wondering, what could I have done? Was there something that I should have said or done to prevent this loss of life? This can also come with feelings of shame. So oftentimes people feel pretty isolated by social networks and others not really knowing what to say and how to respond. That sort of shame and guilt on top of the sadness can make it even more difficult to cope with that loss. And there can often also be feelings of anger at the individual who died and confusion, sort of trying to make sense of why the death happened and what led up to it. Imagine these negative emotions all sort of building upon one another. That can really impact day-to-day functioning. And we know that for some individuals, the process of coping with these feelings and sort of finding a new normal can take up to years, really. So we know that there's a pretty profound impact of suicide loss on family members and friends. And we're also seeing a growing body of research showing that individuals who lose someone to suicide may also then be at increased risk for suicide themselves. Working in suicide prevention, that's very concerning to us because that sort of signals a group that we really want to make sure we're extending resources to and getting connected with help.
Absolutely. And it's helpful to think about how complex the reactions are when somebody experiences a suicide loss, this grief, this anger, guilt, and all these complexities might, as you mentioned, put someone at risk themselves. However, it sounds like some of this previous work is with non-military populations. Could you explain why you wanted to explore this issue with veterans and service members?
Sure. Sort of seeing just very concerning rates of suicide, both within the military and among veterans. And so knowing this, it's likely that many military service members and veterans already know or will know someone who has died by suicide. And so working in military suicide prevention research, we're concerned about this and want to make sure that we really understand how these service members, veterans are potentially impacted by these suicide deaths. And there's been some work to date looking at this issue specifically among veterans. So there was one study surveying veterans in Kentucky, and they found, similar to some of this work in the general population, that those who had been exposed to suicide were more likely than those who hadn't to report having thoughts of suicide themselves, especially if they were close to that individual. And so just seeing those elevated rates of suicide and some of this preliminary research, we really decided it would be important to examine this issue further, sort of in a bigger, broader sample of service members and veterans.
Thank you. So that's a great segue into your current study. It was a rather large sample of veterans and service members in your study. Could you talk to us a little bit about your methods, how you obtained this large sample to look at this issue?
Sure. So the data that we use were collected across actually 15 different studies, all funded by the Military Suicide Research Consortium, and that's an effort funded by the Department of Defense. We were able to look at pretty broad range of studies. So some of these were conducted in research labs, others out in the community or inpatient units or among outpatient mental health patients. So we're able to collect data across a really broad range of settings. And all these studies actually had pretty different purposes as well. So there were treatment studies, also neuroimaging investigations. And so we're able to collect a pretty broad range of data from participants. And one thing that all the studies shared, however, was we used the same battery of self-report surveys. So everyone participating in any of these studies completed the same set of surveys when they first enrolled in the study. And so by aggregating data across these studies, we're able to get that large sample and look at some different geographic regions and also folks with a pretty wide range of sort of psychological functioning and well-being.
Yeah, that's a pretty novel approach. And while that's not the focus of today, I did think it was worth mentioning that, you all were able to pool data across many studies to really get at this research question. And just a cool thing that the Military Suicide Research Consortium is doing within their funded studies to have all investigators ask the same battery of questions so that we're able to do this kind of work and look at these kind of questions across many studies.
Yeah.
So I would like to know, how were participants asked about this topic in these studies?
Sure. So first, we asked a pretty broad question, tried to find out if participants had known anyone at all during their lives who had died by suicide. And if so, then we were able to ask some follow-up questions. We got some information on whether the death had occurred during their military career, also what their relationship was to the person or people who died by suicide. And then we had folks also rate how close they were to the person who had died, and also the effects of that suicide on their lives. So whether it was, no effect at all, or whether they were still experiencing some pretty intense feelings of loss and impact from that. And in addition to that, we're able to collect some information on current suicidal symptoms, prior history of suicidal behavior. So that's past history of suicidal thoughts or attempts, also non-suicidal self-injury. And we also asked about individuals' own perceptions about how likely they might be to actually make a suicide attempt themselves in the future. We used primarily commonly used measures within the field of suicide prevention research to ask these questions.
And how many participants ended up in this sample?
Right. So we ended up with a sample of over 1,700 service members and veterans across those 15 studies.
Okay, it's very helpful kind of framing how you collected the data in the context of it being service members and veterans across different populations. So now turning your findings, it took me when I saw the results of just how many folks did know someone who had died by suicide. And again, thinking about those other terms, who they've been exposed. And then there was a great deal of folks who were also affected and bereaved by suicide. Would you go ahead and tell us a little bit about your results?
Sure. Found that the majority of participants, so around 57% of folks, reported knowing someone who had died by suicide. And this, on the one hand, isn't necessarily surprising, sort of given the rates of suicide that we're seeing among military service members and veterans. For example, the VA, I believe over the summer, released a report that 20 veterans die by suicide each day. And on top of that, we've seen those rates of suicide just within the U.S. per year reaching over 40,000 individuals per year. So it wasn't surprising to us that so many folks knew someone who had died by suicide, but it was still very saddening and concerning to us. And that sort of general pattern of findings really emphasized to us that this is an important issue that needs to be investigated further, sort of that impact of suicide loss among service members and veterans. It's a pretty significant proportion of folks, and gave us reason to believe that we need to understand what that exact impact is a little bit better.
Yeah, I think that's a great point, especially since we think of suicide as a really rare event, but then we also, with studies like these and others that you mentioned earlier, we're getting to this point where we now really can say majority of people know someone who died by suicide or are affected by suicide. And it's like, this is something that affects everyone. And I think it really is a call to action in some ways when you hear those numbers, to really think this is something that's affecting everyone.
Yeah, definitely.
You mentioned that you also asked how well folks knew the person who died and also when the suicide occurred, rather during their career or prior to their military service. What did you find out in those results?
Sure. In terms of when those deaths occurred, we found that about of those who reported knowing someone who died by suicide, close to half reported that suicide death had occurred during their military career. So we didn't end up specifically asking whether the deaths that had occurred during their military careers were of peers within the military. But we did find that about 1/10 of those who lost someone to suicide did lose a fellow service member to suicide. So that's definitely something striking to us. In terms of sort of closeness with the person who died and that impact, we did find sort of consistent with research among the general population. We found that those who reported having been closer to the person who died also were reporting more severe current suicidal symptoms for themselves. And folks also reported more feelings of social disconnection and loneliness as well. And so these findings are, of course, very concerning, since they emphasize that there may be a pretty significant negative impact of losing someone to suicide and suicide bereavement on service members and veterans. And I will say we weren't able to determine if losing someone to suicide definitely caused one's own suicide risk to increase. We don't really know about that causal link yet, but our findings do suggest that there's a relationship there. And that definitely highlights some worrisome effects of suicide bereavement.
So as you mentioned, those who know someone who died by suicide appear to be at increased risk themselves. And when you frame it in the context, as you explained earlier, with all these emotions and the complexity of understanding and facing a loss such as suicide, it's sort of, we can see the picture forming where people might be at risk themselves. Could you talk to us a little bit more about how that relationship might happen, even though, like you said, we don't have a causal mechanism here, but just give us a sense of how that might be happening?
Sure. So at this point, this is sort of an emerging area of research. So there's a couple different theories that researchers have put out there. So one thought is that there may be some form of genetic or environmental risk. So relatives who are bereaved by suicide might share sort of that familial environment or genetic risk for suicidal behavior, as well as psychiatric disorders that we know are associated with increased suicide risk. So as a result of that sort of genetic familial link, family members may then go on to die by suicide. Others have also examined the possibility that there might be some shared environmental exposure. So really thinking about with military service members and veterans, two service members might experience a really similar, highly traumatic combat experience. And so they may both then sort of struggle to cope with that and both die by suicide. And so that might account for that connection as well, sort of that shared exposure. And still there's a lot of other theories out there. So maybe just that really intense distress, the loneliness, or those changes in social connection and difficulties coping with all of that follow loss of a close loved one may then sort of result in death by suicide of someone who's experienced a loss. But it is an emerging area of research, and we're definitely looking forward to sort of growing work in this area to shed light on this, because this might help us to understand a little bit better how to screen for folks at risk for suicide, and also to figure out what intervention approaches are going to be the most effective.
Absolutely. And again, thinking about intervention approaches, we've now identified that this is a group at risk for self-directed violence themselves. So how can we use this as a suicide prevention strategy?
At this point, I'm hesitant to say that necessarily providing sort of postvention support following a suicide loss, a surefire suicide prevention strategy itself. We sort of need more studies to figure out whether this support will ultimately prevent future suicides. But regardless of that, we're seeing a pretty high level of distress among folks who lose someone to suicide. And so with that, we're also seeing studies that are showing that the majority of those who lose someone to suicide say they feel a need for mental health services and they want to get connected, but only about a quarter of folks end up getting connected with care. And so knowing that there may be some increased risk and that folks really want connection with services, and knowing that there are great resources out there, so therapists, support groups, online resources, I think results like from this study can just sort of drive us to recognize the importance of encouraging connection to care among folks who lose someone to suicide. It can be really difficult to make that first step to get connected and reach out for help. We know from research among military service members that if they receive some encouragement from family members and friends to get help, they're going to be a lot more likely to seek out services. So if we know service members or veterans who have lost someone to suicide, sort of our role can be to encourage them to make some of those connections.
Yeah, thanks for mentioning that. And just the idea of connectedness is a very common theme in suicide prevention. And, that's connecting to others, connecting to care. Sounds like if this is a group that we can focus postvention efforts on, like you said, we need more research, but we could ultimately maybe see this as a suicide prevention strategy, knowing that this group is distressed and is at risk themselves.
Right.
So talk to us a little bit about clinical directions that we can use with this information, what kind of things providers should be asking in a clinical session to sort of help them identify those who may be experiencing distress after suicide loss, and what they can do in terms of recommendations. You already mentioned support groups, but just going into that a little bit more for us.
Sure. So I think in terms of clinical implications, something that is important to keep in mind, and that we know from research in the general population, is that folks who've lost someone to suicide may understandably have some negative attitudes towards mental health clinicians, especially if their loved one was in mental health treatment at the time of their death. And so knowing this, it may be important for clinicians working with folks who have experienced a suicide loss to be especially sensitive to this and to provide an opportunity to address specific blame or anger or mistrust of the mental health care system itself, and to acknowledge that in some instances it may have failed their loved one and their family. So that's something that often we don't necessarily think of, but that can really impact how those bereaved by suicide engage with care. And as you mentioned, there is that mix of emotions. And so really acknowledging that there's this wealth of conflicting emotions. So the sadness on top of that, self-blame, anger at the loved one that they lost, acknowledging that and making sure to really address each of those reactions can be helpful. And then, as I mentioned, there are just a really great directory of support groups out there. And so for clinicians, being aware of how to effectively refer individuals is important. So the American Association of Suicidology, for instance, offers a really great directory of support groups that are based across the country that offer an experience for those who have lost someone to suicide to really open up and to sort of experience that normalization of their own reactions, because it can be really tough not knowing someone who's gone through something similar, and that mix of emotions is confusing. So interfacing with others can be really helpful.
That's great. And of course, we will include links with the post when it goes live so that folks can check out these resources. I know that we're also aware of some resources through the TAPS program, which is Tragedy Assistance Program for Survivors, which is especially for military families, and there's other organizations as well. So there are support out there, and I think that's obviously an important message to accompany this idea that folks are at increased risk, but there are support and help out there and available, and many of which is free or at very low cost. Again, thanks for mentioning that.
Sure.
Obviously, we now have sort of a growing body of evidence. We mentioned Dr. Sorrell and her work. Now your study sort of adds to those findings. Where are we with the research, and what are next steps? And also, what are some limitations that we need to address for future studies that are going to look at this issue?
Sure. So at this point, we've definitely only sort of scratched the surface in terms of understanding experiences with suicide loss, especially among military service members and veterans. So a lot of what we know is about sort of family members and friends losing someone, but oftentimes those connections formed between service members are incredibly deep, and we don't know much about how losing a pure service member impacts someone. And so right now we have a sense that there is an impact, but we're hoping to learn a little bit more about some factors that may lead to increased risk among someone who's lost someone to suicide, what factors may prevent someone or protect someone against risk. So really getting to know a little bit more about service members' experiences. And that will involve some studies that are able to follow service members over time. So our current study was limited in that we're asking folks to report on sort of past events and their current suicide risk, but we weren't following folks over weeks, months, and years following the suicide death. And so to be able to better understand some of these processes, we're hoping to be able to conduct some more longitudinal studies to really get into some of the details there. And then clinically, again, we have some resources out there, such as the support groups that we've been talking about, but we, again, don't know much about experiences of service members and veterans in these support groups, and some pretty rigorous suicide prevention research trials to get more into that and to see, is this actually preventing suicide in the future? What are some of the positive effects of these groups, and how can they be made even better? So those are some areas we're looking to for the future.
Excellent. Well, again, thanks so much for shedding light on this topic with us today, Melanie. Any final comments before we let you go for today?
One final comment is just, it can be helpful to keep in mind, both as researchers and clinicians, that this work can be done compassionately and safely. I think there are often concerns among researchers and clinicians that it might be uncomfortable to ask about suicide loss, that asking about it may cause someone to become very upset or may increase their suicide risk. But the feedback that we've received and that other researchers have received from those affected by the loss of a loved one to suicide is that they really appreciate having the opportunity to talk about these experiences, and that being included in these studies is often really helpful and perceived as very welcomed. So I think just keeping that in mind and knowing that there are folks out there who really want to talk about these issues and are really happy and glad that attention is finally being paid to this topic. I think that's helpful to keep in mind just going into these situations, knowing that we can bring it up And that by bringing it up, we're able to all together sort of work to combat a lot of the stigma around suicide.
Fantastic. That's a great note to end on. Again, we appreciate your time today, Melanie. Folks, you can learn more about Ms. Hom and her work by clicking on the links with the podcast, including Dr. Joyner's lab, as well as some of the support resources. Listeners, again, thanks for your time today tuning in. You can reach out to us with any questions or comments about today's episode. Take a moment to subscribe, give us a review, and share with colleagues. Until next time, we'll be back with more interviews on important work in suicide prevention.